Two future babies include had their spines restored by surgeons, weeks up they were unborn. The operative, that are the at first always of their type in the UK, were transferred out by a crew of 30 doctors at College School Clinic in London. The babies had spina hernia, a state while the dorsal string fails to evolve correctly and has a gap in it. It is normally purified following childbirth, but the over it is restored the superior for length-term public health and portability. For the 90 men surgical transferred out the summer, doctors cut an discovery in the uterus and later sewn along the infant's gap in the spinal. The order is dangerous and can reason untimely labor, but researchers are studying less than aggressive keyhole methods. We put the mum on several drugs how assist soften them, but down there is yet a hazard, told UCL Professor Anne David, who has treated on earning the surgical to the UK for 3 years. Mums and babies are convalescent so, the clinic told. Mothers previous had to go overseas to the US, Belgium or Switzerland for the transactions. He's fabulous, told Professor David. Female now dong t include to journey out of the UK. They can include their household in them. Down there are less than cost. So all nice things. Onto the Mercy Light, more than rather than 200 family are unborn in spina hernia each year. Surgical can be utilized to shut the gap in the spinal in largest cases, but frequently the nerve framework will already include been corrupt guideline to problems consisting palsy of the legs and intemperance. Several human beings in the state include training difficult situation. It is not named which causes the state that develops for pregnant, but a absence of folic acidity can growth the hazard. The surgical, that follows a test in the US, will be accessible for patients via the new Center for Antenatal Treatment at Large Ormond Road Clinic and UCL Clinic. Down there were several family who had grown up next intrauterine surgical who were walk and you wouldn't wait them to be walk if they hadn't had he, told Professor David, of the latter US research.